That's my colleague Nick Harper in Washington, D.C. Here at home, we speak to Patrick Tippoo, who is Head of Science and Innovation at Biovac and Executive Director of the African Vaccine Manufacturing Initiative. A very good evening to you. Thank you so much for speaking to us. So what will be the first order of business for the Biovac plant in Cape Town to be able to pump out these millions of Pfizer vaccines for Africa?
Thank you. Good evening for this opportunity. Yes, the first order of business would be focused on the facility and getting the equipment into the facility, installed, commissioned, and fully validated, qualified to guarantee that it's fit for purpose. The second area of focus would be the transfer of skills and the working understanding of the processes and the activities associated with the filling and the finishing of this vaccine. So that would be the order of business in the immediate future.
So we were very excited about these developments when the announcement was made, but I understand that what Biovac will be only doing is handling the distribution and full finish, the final phase of the manufacturing process. Is this a disappointment for those who are expecting more of involvement in the manufacturing of this?
I think what must be appreciated is that vaccine production, vaccine manufacture is a highly complex set of activities, and we at Biovac have been building this capability over the last few years, not only in procurement and distribution of vaccine, full finish and manufacture of vaccine, but also focusing on vaccine R&D. So the point to appreciate is that one needs to step through this in digestible, bite-sized chunks. And this deal with Pfizer does shift the needle significantly. This would be the first country, the first company in Africa, as was mentioned, to manufacture an mRNA vaccine, and in the southern hemisphere, actually. And I think that this is a huge step towards building this large-scale capacity to make modern vaccines on the African continent.
Okay.
The end game is full vaccine manufacture eventually.
Okay, so we'll get back to, in just a moment, how much more involved we can get, but I want to understand what other caveats does the deal come with?
I think the deal is quite simple as we understand it. It's the full finish of vaccines and of the mRNA vaccine, the COVID mRNA vaccine. And as was mentioned before, the great thing is that this vaccine will be specifically targeted to African countries to assist with the supply of vaccines into Africa.
Okay. So, as you mentioned, it's a step in the right direction, but I just want to understand what would need to happen. If the vaccine is only partly produced in Africa, some would argue that it pays partial lip service to the pledge to share scientific intellectual property and technology. So what would need to happen for us to get to that point, to move beyond the starting of the fill finish to another phase?
So there are a number of facets that we need to attend to, and this is not in order of priority, but essentially one needs to have the physical infrastructure on the ground in order to absorb the manufacturing technology in its different phases. This is the upstream bit, which is the focus of your question, as well as the downstream bit, which is the formulation full finish. And so essentially you need the infrastructure, and this is a plan that Biovac has had even before COVID, to expand its infrastructure, because one needs the right scale of manufacturing capacity. So the next thing for us to do is to secure funding for our large-scale facilities and that would take 3 to 4 years to roll out so that we can move towards this end goal. The other big area is the area of skills. We need to invest in training and skills development because a manufacturing workforce cannot be created overnight. And this is something that would be focused on in the next months and years in earnest.
All right. Thank you very much for speaking to us. Patrick Tippoo is Head of Science and Innovation at Biovac and Executive Director of the African Vaccine Manufacturing Initiative. As he says, a little goes a long way.